I'm Steve Morris, Clinical Director of the Sussex Back Pain Clinic and an osteopath with over 20 years of experience helping thousands of patients with back pain. Like many practitioners, the fact that some patients don't respond to treatment really bothers me. Over my time in practice, I've noticed that most of these people have had some form of disc damage. They are usually suffering from slip disc in the neck or back, spinal degeneration or arthritis, and sciatica. These conditions are notoriously difficult to treat with manual therapy alone, and until recently, the only choice has been to send them off for surgery or to be relying on painkillers. However, since discovering IDD therapy and having a unit installed within the practice, we've been able to help many more of these patients. Patients that have previously not responded to other treatments. IDD isn't a miracle cure for all, but it may be an effective, non-invasive choice for you. We've achieved some remarkable results and have prevented many patients having to undergo surgery, allowing them to return to a normal life. So, what does IDD do? The unit uses advanced computer engineering to allow us to use controlled angles to target very specific regions in your back where the disc is damaged, and then safely and gently pull them apart, a process known as distraction. This can decompress the spinal discs to reduce the bulge, stretch tight and shorten muscles, and improve mobility in stiff ligaments and spinal joints. What we aim to do with this treatment is to get you out of pain and help your spine move more freely so that you are up and about and back doing what you want to do within a 6-week period of treatment. The treatment is safe and gentle, and you are treated fully clothed. All you have to do is lay back and relax, and the unit will do all the work to gently begin to decompress your discs. During your treatment course, there are some basic exercises to do to build up the strength and support for your back to ensure that it can work to its full potential. Working with IDD therapy has been immensely rewarding for me, helping patients get out of pain, restoring their mobility and allowing them to heal, and seeing how this can literally change their lives, all without the use of any invasive procedure. Here's just a few of our patients to tell you what they think about this groundbreaking treatment.
Before I had the IDD treatment, I had 2 prolapsed discs in my back, which meant I had really bad lower back pain, acute sciatica all the way down my left leg, into my ankle and my toes, pins and needles. Really couldn't do very much. I couldn't walk at all without a stick. Just getting in and out of a chair was really painful.
Just pain in my lower back just got progressively worse over the last 18 months, 2 years, to the point that I couldn't even sit, walk, standing was virtually impossible.
I had 2 dehydrated discs in my back, which was causing severe pain in my right leg and hip, and a dull sensation in my lower back area. The pain was affecting my day-to-day life through not being able to work correctly, i.e. lifting equipment, etc., which I've done all my life. My sports were obviously very limited.
The IDD treatment I found was fantastic, and the staff were brilliant, very caring, very comforting, made me feel really at ease.
Treatment's been really good. It's sort of like almost from the first session that I had, which was it was really hard just to get down here and actually get into the clinic and get onto the bed. But from the moment I had the first session, you could almost feel an improvement straight away.
After my first treatment, I was alleviated of a lot of pain, and while continuing the course, I'm halfway through now, and I'm making good progress.
The treatment that I've had has worked really well. I'm now completely pain-free. My life is getting back to normal. I can now do all the normal everyday things without any discomfort at all. It's obviously just strengthening my back and my core stability to make sure that I don't do this again.
I'm halfway through the treatment and I can sit, stand, walk, almost ready to go back to work really. So yeah, it's been a great improvement.
If you want to know any more about IDD therapy, just fill in the request form on our website for an information pack, or ring the practice to book your assessment appointment.